comprehensive support system and programs. Regarding what the government is doing to ensure the mentorship program of the medical interns is effective, integrated for both professional development and emotional support, Honorable Speaker and esteemed members, the Ministry of Health has undertaken several initiatives to enhance mentorship programs for medical interns by integrating both professional development and emotional support. Recognizing the demanding nature of medical training, these efforts aim to create a well-rounded support system that fosters both clinical competence and mental well-being. A key component of this approach is the ministry's collaboration with KMPDC to strengthen mentorship frameworks. Through these partnerships, structured mentorship programs have been designed to provide guidance on career growth, ethical practice, and professional development, while also addressing the emotional challenges faced by interns. These initiatives include training of internship coordinators and supervisors, where the Ministry and KMPDC have instituted mandatory training programs for internship coordinators and supervisors across all accredited healthcare institutions. These programs are designed to equip mentors with the necessary skills to provide structured guidance, supervision, and psychosocial support to medical interns throughout the internship period. Secondly, oversight through the Fitness to Practice Committee. The Fitness to Practice Committee of KMPDC plays a pivotal role in monitoring and evaluating the professional and ethical conduct of medical interns. Through this framework, the Council maintains a structured follow-up mechanism that extends beyond the internship program, ensuring that medical practitioners receive continued professional oversight and mentorship as they progress in their careers. These measures are part of a broader strategy aimed at strengthening internship training, fostering a supportive learning environment, and enhancing the overall quality of medical education and professional practice in Kenya. The ministry remains steadfast in its commitment to upholding high standards of medical training and mentorship in line with statutory and regulatory provisions. Thirdly, national guidelines for internship training. The KMPDC has developed comprehensive guidelines for internship training. These guidelines emphasize the importance of mentorship in fostering professional growth and ensuring the well-being of medical interns. They outline the competencies and skills to be acquired during the internship period, providing a structured framework for both professional and personal development. Through this initiative, the ministry aims to provide a holistic mentorship experience for medical interns, integrating professional development with emotional and psychosocial support to ensure their well-being and effectiveness in healthcare system. I submit.
Thank you, Cabinet Secretary. Senator Hamida, your supplementary question.
Just a quick question. I was just thinking, Madam CS, by the time you implement what you have addressed us, the interns would have lost hope, and you know what it is with them. Of course, they die, they kill themselves. And I'm just wondering, does SHA cover psychological therapy sessions? Because that's what they require now. And since we don't want to lose any more lives, since they're still claiming they sleep hungry and they have no hope. Thank you.
Cabinet Secretary.
Thank you, Honorable Speaker and Honorable Member. One of the great achievements we have under the Social Health Authority is coverage of mental health disorder, and we are happy to report that it is incorporated, and under SHA, the medical interns can access mental health services, including rehabilitation of substance abuse disorders.
Senator Hezena, supplementary question.
Thank you, Mr. Speaker. First of all, I want to appreciate the Cabinet Secretary. I know we must give Caesar what belongs to them, despite the grilling today. Because following the statement I made on the cancer center and the prevalence of cancer in Samburu, sometime late last year, I had a very proactive response from the Cabinet Secretary where her entire team and the National Cancer Center went to Samburu. They had a 3-day screening exercise, I think, across the 2 constituencies, Samburu East and West, which I truly appreciate. But I think next time, you need to involve political leaders or grassroots leaders, even like the chief and the DCs, so that they can mobilize the community, because Samburu County is a place where there is people are scarcely populated, and we needed to do mobilization for people to travel. And I know you are very surprised because you are at the town centers like Wamba and Kisima and Maralal, and it was having a low turnout because you didn't mobilize in time. So I hope you do this exercise again, as you have seen that it is truly a disaster in Samburu. Secondly, I appreciate you for launching the Oncology Center in Samburu County. I'm sorry I couldn't attend because we had a burial as senators. And we are very proud as the oversight body when we see leaders in the executive taking very proactive measures. And we hope with the same breath that the things you have promised, you're going to move with speed. So that girl child is not underestimated. In my supplementary question, I would like to know if there are any measures you're taking towards ensuring that mental health is addressed among the youth. You know very well that the people I represent are the population that is largely affected by mental health. And there was a statement I did on requesting the ministry to ensure that we have mental health desks in all public health centers and hospitals, to ensure that at least even citizens know that there's something called mental health, and they can walk into a health facility and seek mental health services just like they seek help for any other illness or ailment. Lastly, I would like to know from the Cabinet Secretary.
Senator, you're only allowed one supplementary question.
I think it's related, Mr. Speaker.
But only one question. And I also gave you a lot of leeway in giving your long story about Samburu County. So can we allow other senators to ask a question?
Thank you, Mr. Speaker. It's important to show gratitude so that Kenyans know what steps are being made. We can't criticize without showing gratitude. Thank you, Mr. Speaker.
Thank you,
but
Senator.
I beg you to just ask this question
Very
because
well.
it's related.
Very quickly, please.
My mic. I would like to know if, you know, it's very essential for public health facilities to have proper hygiene. Is the ministry working in collaboration with other organizations or have any programs to ensure that water is provided in public health facilities? Thank you.
Senator Mohammed Chute.
Thank you very much, Honorable Speaker. Let me thank the CS for being here today. And sometimes I wonder how she's going to manage this ministry. And I don't know if she has thought of even resigning because the situation.
Senator,
which is, yes.
Senator Chute.
Yes. Okay.
Ask your question related to the principal question that was raised by Senator Hamida, and stick to the question only, please.
Honorable Speaker, it is related because of the pressure the CS is facing. Anyway, let me go back to my question, Honorable Speaker. Honorable Speaker, the question I have is there is an outbreak of Kalaza in both Logologo and Laisamis. I wanted to know if the minister is aware and what action has he taken. And again, Honorable Speaker, I have 2 patients, one in Nyeri, one in Isili. The one in Nyeri died last week. My condolences to the family. But what I came to know, Honorable Speaker, is SHA is paying for bed and also surgery only. I want the Cabinet Secretary to tell us what happens if somebody is admitted in the ICU and also other costs, which is doctor's cost and other related costs. How is SHA going to honor those payments? Thank you very much, Honorable Speaker.
Senator Kavindu.
Thank you, Mr. Speaker, for this opportunity. Mine is just a confirmation from Madam CS, Honorable CS. If SHA is covering mental health and drug abuse related issues, because that is very common in our villages. And these people pay for SHA, and I want to know if this is covered by SHA. Thank you, Madam CS.
Can we allow the CS to answer those 3 questions and then take the other questions? CS?
Thank you, Honorable Speaker and honorable members. For mental health among youth as a national, we have been able to develop guidelines and also have strategies and action plans to ensure that mental health is addressed, not only for the youth, but population across. And as said earlier, we have the national guideline on workplace mental wellness. We have, again, we are working on integration of mental health into the primary care, utilizing our interns, medical interns, and other healthcare professions in order to identify mental illness earlier, and again, institute interventions or also improve the referral mechanism. Equally, we have the clinical guidelines for mental disorder. That way they can be implemented at county level. And we have the, again, oversight and oversight of the same on mental health illness. So it is something that we are working, and we hope to collaborate and also ensure that there's implementation at county level. Regarding the water, sanitation, and hygiene component, yes, we are working together with the ministry as well as county and stakeholders to ensure that our health facilities, including our primary health care facilities, have the wash component is addressed. And we even have guidelines and monitoring assessment for healthcare facilities where we conduct to ensure that water, sanitation, and hygiene is up to, capacity in order to avoid the spread of infection. For Kalaza in Marsabit, yes, Kalaza is a neglected tropical disease caused by Leishmania parasite, and Marsabit has reported 19 cases since 2025. And what we are doing is sensitizing the communities on Kalaza and other forms, and also having case management focal points at Marsabit, at the hospital, in order to treat and also improve the surveillance and continuous detection of these cases so that we can be able to control whenever there is a concern. Regarding vector control is another area that we are looking into, as well as capacity building healthcare workers in matters detection and management of Kalazam. We also have medicines available for the treatment of the condition, and implementation is ongoing. I believe that, as we had said earlier in the committee, we will be able to share a comprehensive report, which will also incorporate the various benefit packages, as well as the improvement that has been done with regards to the intensive care unit, that is the ICU, among others. For mental health and substance abuse, yes, we are happy to report that SHA actually covers, unlike NHIF, mental health and substance abuse rehabilitation. And we are